Welcome, everyone, to our next recorded session on lactation and policy. I have Cecilia Maldonado today, who will be sharing about lactation and policy with her presentation, Breastfeeding Laws, Protecting the Rights of Nursing Families. And in these expert insight sessions, we invite folks who are doing the work to help us better understand how to provide equitable care, what health equity looks like in practice, and I invite you all to really lean into the insights that Cecilia is going to be sharing with us today on this topic. And just to share a little bit more about her, she's the Regional Breastfeeding Liaison and Health Education Specialist with the Department of Public Health WIC program. Um, in her role as the regional breastfeeding liaison, she works directly with healthcare providers, hospitals, community organizations, and employers to strengthen breastfeeding support. And so we know that this is a super important topic as it relates to maternal health. And so with that, I will turn it over to you, Cecilia, and I welcome and invite you. Thank you so much for being here.
Thank you so very much for that warm introduction. I'm going to go ahead and share my screen. Breastfeeding is a journey, and while there's a lot of information out there, knowing the actual laws is the best way to ensure families feel protected and empowered. Today, we'll break down what those rights look like in practice. So, hi everyone, my name is Cecilia Maldonado, and I serve as the Regional Breastfeeding Liaison for San Bernardino County WIC. Let's get started. Here's an important note. This information is for general use only, and it is not a legal document. The San Bernardino County Department of Public Health is sharing this to help community partners learn more about the breastfeeding laws. We try our very best to keep everything accurate. However, please note that the official updates may occur before we can update this material. Thank you for your understanding. Our objectives for today are very straightforward. We'll start with the laws themselves. We'll move into why these laws are needed, and we'll finish with the role in supporting nursing families. It is important to understand that breastfeeding rights aren't just suggestions. They're legally protected at both the state and federal levels. In California, we have very specific labor and civil codes that protect nursing in public and at work. We're going to dive into the specifics of each of these throughout this presentation. And as you'll see presented here under the umbrella of the state laws, we have the Workplace Lactation Accommodation Law. We have the right to breastfeed in public. Under the federal law umbrella, we have providing urgent maternal protection, which is also known as the PUMP Act. And then we also have the Fair Labor Standards Act. Under the Workplace Lactation Accommodation Law, employers are required to provide two things. Number one, a reasonable break time, and number two, a private space. Regarding time, breaks should cover setting up, expressing milk, storing it, and cleaning the equipment. While employees can use their paid breaks for this, any additional time needed is generally unpaid. There's a lot of confusion about pay during these breaks. Lactation breaks must be paid if the employee is not completely relieved from their duty. If an employee chooses to work while pumping, like answering emails or staying on a conference call, they must be paid for that time. An employer cannot force an employee to work while they are pumping. It is entirely up to the employee's choice. Regarding space, privacy is key. The space must be shielded from view and free from intrusions. A toilet stall or restroom is never an acceptable space. The area must be clean near the workplace and include an electrical outlet, a table, and comfortable seating. Employees must have access to a sink with running water and a refrigerator or a cooler nearby. The lactation accommodation law also requires employers to develop and implement a policy regarding lactation accommodation. as you'll see here on the right side. As part of that promotion, the county has adopted a workplace lactation accommodation policy to support employed mothers to continue to breastfeed after they return to work. This policy was written to ensure compliance with both the federal and state laws. The employer shall include this policy in break rooms and office bulletin boards, and should distribute the policy to new employees upon hiring and when an employee makes a parental leave request. Any questions regarding implementing this policy should be directed to the Human Resources and/or to the Regional Breastfeeding Liaison. The PUMP Act closes legal gaps to protect nearly all lactating employees who are previously left out. Let's take a closer look at what has changed and the extended coverage. This chart highlights the main differences between the old law versus the new law. And you'll see here highlighted in yellow what has changed. So employers with 50 or more employees are now legally required to provide these accommodations. Employees now have the right to sue employers who fail to provide the necessary time and private space. Pumping time must be paid if the employee is still performing any work duties during their break. Now let's talk about the right to breastfeeding in public. This is something that is personally very important to me. I was approached by a security guard at a local hospital once and told that I could not breastfeed there. Even in a healthcare setting, there can be a lack of awareness about this law. The truth is that under the California Civil Code 43.3, a parent has a legal right to breastfeed their child in any public space. The only exception is if you are somewhere you aren't legally to be in, like a private residence or a restricted building. But in any space open to the public, including hospitals, grocery stores, and parks, you are protected. You should never have to feel like you're doing something wrong by feeding your child. It's about public access and removing the shame or the hiding that many parents feel pressured into. So, why are these breastfeeding laws needed? Breastfeeding laws give lactating parents the protections to breastfeed in public and express milk at their workplaces. It removes the social barrier and stigma. Laws help shift public perception so breastfeeding is seen more of a normal thing to do. Safeguards economic stability for working parents. Laws ensure parents don't have to choose between their paycheck and their child's nutrition. It improves public health outcomes. Increased breastfeeding rates lead to lower risks of asthma, obesity, and SIDS for infants, plus reduced cancer risk for mothers. Also, the direct business and societal barriers and benefits. Supportive workplaces see lower employee turnover, reduction in employees being absent, and higher morale. So, only 25% of babies in the US reach the 6-month mark of exclusive breastfeeding. The American Academy of Pediatrics recommends exclusive breastfeeding for the first 6 months, followed by continued breastfeeding alongside solid foods for 2 years or longer. Reaching this goal is often not a matter of choice, but a matter of access. Many families feel it is out of reach due to the lack of perhaps emotional and physical support. Breastfeeding education, professional assistance like a lactation consultant or an IBCLC, and also workplace accommodations. Without these critical supports, many parents are forced to end their breastfeeding journey earlier than intended. So, our job is to protect employee rights and improve the overall health of the workforce. As coordinators and managers, you are the frontline defenders. The success of our breastfeeding policy depends entirely on how you implement it. There are 3 ways you can help. Number one, communicate. Make sure employees know their rights and what resources are available to help them before they return from leave. Number two, training. Ensure everyone on the team understands the policy so that supportive environments become the standard and not the exception. And number three, provide encouragement. A little support goes a long way. Simply telling an employee, you can do this, helps them feel valued and less stressed about balancing work and their family. So the impact here is when we get this right, we keep our best talent, we reduce sick days, and we build a more loyal and healthy team. This information is sourced from the California Breastfeeding Intention and Duration Dashboard. The data illustrates the rate of exclusive breastfeeding at 3 months for both San Bernardino County and the entire state of California. So you'll see here that San Bernardino County falls a little shy of 30%, and that's what the state goal is. So WIC provides more than just food. It offers a full circle of support for our breastfeeding families. We provide breastfeeding education through Zoom classes and through phone calls as well. Lactation specialist. So all of our staff here is highly trained on breastfeeding so they can provide that support to our families. Our pump program. We help provide breast pumps, which are vital for our parents returning to work or school. Also, something that is not noted on here is our pump closet. So we have a pump closet at San Bernardino Hospital where we provide hospital-grade pumps to WIC-eligible NICU moms. And we also have registered dietitians. Our dietitians ensure both the parent and the baby are getting the right nutrients to support a healthy breastfeeding journey. All these services are available at no cost to WIC participants. And for more information, you can visit wic.sbcounty.gov or contact 1-800-472-2321. If rights are being ignored, there are resources available to help. So here is a flyer on the Wage and Hour Division of the U.S. Department of Labor. And there's a phone number there and also a website. There's also a free legal helpline available as well through the Work-Life Law. And some of these links provided here are from the resources referenced in the presentation, while others are additional materials that can aid in understanding the laws surrounding breastfeeding. Now let's talk about some key takeaways from today's presentation. Number one, breastfeeding isn't just a choice, it's a legally protected right. Number two, these laws do more than just protect one person. They improve health for babies, mothers, and the entire community. And number three, there are tools and organizations available to help you understand your specific rights. Use the resources we've discussed to navigate any legal or workplace challenges you might be facing or might face. Thank you for joining us today. Educate yourself, your family, and your community about breastfeeding laws. Thank you.
Was wonderful, Cecilia. Thank you so much for educating us. And we hope that those of you who joined us to view this recording and learn today about the rights of families, I really appreciated that final takeaway that breastfeeding is not only a choice, but it is a right and it's legally protected. And now folks have access to information and resources for where to go to learn more, as well as where to get help in order to access that right. And so, thank you. We invite you all to let us know your thoughts and other topics that you'd like to hear in the future. And Cecilia, thank you for being here with us today.
Thank you.